Now, what I want to talk about this week is the big elephant in the room, okay? And that is how your clinical skills and your lack of confidence and clarity is actually impacting your business's potential for growth. So this week, what I want to talk about and ask you the question, are you actually treating your patients too long? Okay, so are your appointments 1 hour? Okay, are your appointments 45 minutes? And if you ask yourself, do you actually genuinely need to have that much time with a patient? Okay, sometimes I think you'll actually come to the realization that you don't need that much time. Okay, if you've got a very structured step-by-step system, you're using a constraint-based approach where every session you have your goal, okay, which is just hitting that goal. You give that patient a few days or a week to continue to get used to that loading. The next session you load them a bit more, and away you go, and you're always working towards that ideal outcome. You'll find that you don't need to waste time trying to treat everything. Okay, if you're trying to throw shit at the wall and hoping something sticks, you probably will need an hour. If you can have that structured system in place where you have the confidence and clarity to know what you want to be spending 80% of your time with, know what you want to spend 20% of your time with, then you can cut that time down quite a bit. Now, even 45-minute appointments can be quite problematic, okay? Because again, if you've got gaps between, you have 3 appointments on the hour and they're all 45-minute appointments, you've pretty much lost one session, okay? And if one session to you is worth 50 euros, dollars, pounds, whatever your currency is, that's going to add up over the year, okay? And you're ultimately leaking money, you're wasting time. If you get very slick, you get that clinical structure in place, you get the confidence, you understand what you're trying to do every session, you eliminate those hours to 45 to 30 minutes with the majority of your patients, then you're pretty much doubling your income for doing the same amount of work, okay? So I'll just repeat, if you're doing hour-long sessions and you get them down to 30 minutes eventually, that takes a little bit of time and with that has to come confidence and clarity and structure in your assessments and your treatment and your return to play, return to life rehab programs. You can pretty much earn double what you're earning for doing the same work. Okay, and that's why a lot of the therapist mentorship program, the vast majority about it is giving you that structure, that clinical excellence, okay, that we're all striving for, that structure, that clinical reasoning of every session, okay, to get them to the ideal outcome. That's the thing that allows you to be very clear, so you don't need an hour for every single session. Absolutely, some persistent pain cases, you may need to take a little bit more time with them. That's absolutely fine. But for the majority of patients, okay, we can get through in our clinic with 30 minutes if we've got the confidence and clarity. Is the quality of our sessions gone down because we're giving them 30 minutes instead of 60? Absolutely not. And anyone who says that, bullshit, okay? What we have done is we've made sure that in that session we are on top of our game. Because what happened to me was I knew I had 45 minutes with a patient, I knew it an hour. Next thing you're rubbing that quad or that calf for 15 minutes when you didn't need to. Whereas now what I need to do is I need to go and I need to desensitize that gastroc, that quad, whatever it is, and I'm very intentional with what I'm doing. So I'm putting myself under pressure, okay, to get what I need done in 30 minutes. It keeps me very focused, keeps my attention, and I'm good to go. And what myself and a lot of the other therapists in the clinic, the day goes a lot faster as well, and you just have a lot more intent with what you're doing, okay? Whereas a lot of therapists, they're trying to treat everything and hope for the best. If you can get that confidence and clarity and step-by-step system, then you can cut a lot of these sessions down to 30 minutes, okay? As I said, if your client has a lot more persistent pain, then that's fair enough, okay? But even with a lot of those, we can still, after the first session or two, we can still get them down to 30 minutes because every session we've got a plan where we've got progress and we're keep hitting those targets to make sure that we get that person the ideal outcome that gives them the meaningful impact on their life that adds such value to them. Okay, so as I said, I've addressed the big elephant in the room today. Okay, is your clinical skills impacting your business? Are you wasting time and energy because you lack that confidence, clarity, and structure? If you want some more confidence, clarity, and structure, get in touch. The therapist mentorship program is designed specifically to give you that, to rapidly increase your retention, your revenue, your referrals, okay? But it's all based on getting real world results with real people that you make a big impact on their lives.